Hi friends, it's Jessica Morris here from OurBrainBank, wishing you well. I wanted to share with you the recent new chapter in my story. So as many of you may be aware, I was diagnosed with glioblastoma in January 2016. All good, did a ton of treatments, and then I had a recurrence at the end of August this year, and I had surgery to remove that. And I then embarked with my husband Ed on a major re-research of all the options that might be out there. And I asked a ton of patients, a ton of caregivers, a ton of friends. And I had a brilliant response. So thank you to everybody for that. And I went on with Ed, we went on a bit of a journey to go and get some other opinions about what to do. And I ended up here in Boston at Brigham Women's Hospital and the Dana-Farber Cancer Center. I'm still treated by Fabio Moto at Columbia, but here there's a clinical trial. And tomorrow I'm going to have surgery, and the surgery is going to involve drilling a little hole into my skull, inserting a catheter, and then slowly over the course of several hours putting in an adapted version of the herpes virus. The idea is that this herpes virus will essentially stick on the cancer cells in my brain. And in so doing, it will awaken, we hope, a huge immune response from my immune system, which will recognize the herpes and think, okay, that doesn't belong inside this woman's brain, and kick it out. It won't affect my healthy cells. I'm excited about this. It's a new treatment. I'm going to be the first of a cohort of patients taking the maximum dose of this adapted herpes virus. And although it's a phase 1 trial, which means it's really testing the safety of the drug, it's a very similar mechanism of action that's been used in a number of other viral trials for glioblastoma, most notably the polio trial. So I'm starting this tomorrow, and I'll be in hospital, I think, for 2 or 3 days. And I'm thanking everybody who's helped me get to this point. I'm excited to be at the forefront of taking in an innovative treatment. I feel humbled by the fact that because I happen to live here and I happen to have good insurance, I'm able to do this. I wish everybody could. I hope that the trial succeeds for all of us. I'll keep you posted, and wish me luck. But you know what? If it does work, let's find a way of sharing this, or let's find a way of making it fairer for anybody throughout the world. Glioblastoma is a indiscriminatory disease. It can hit anybody. We don't know why. It can hit anybody anywhere. And it's highly unlikely, because it's so rare, that anybody will have thought it might happen to them. And just by accident, I happen to have good medical research, and I happen to live in the United States. It means I happen to live in a part of the United States which is really near to some really amazing scientists and cancer centers. It means I happen to be able to access the most incredible care and the most incredible opportunities. And I want to make sure that we can make those available for anybody facing the disease, wherever they are in the world. We're working on that in our brain bank, so please keep in touch with us. We're going to be launching a sort of global, patients' charter, Bill of Rights over the next few months. We're actually going live in the UK quite soon, and shortly in Australia. And thank you so much for supporting us financially, emotionally, in every kind of way, because people like me are desperate, and we need it, and we value it, and it means a lot. So thank you. Cheers. Bye.